the success is nothing but a IUI success is equivalent to how many couples watching this video touch your heart and say, spending money is secondary, but to get that pregnancy, your IUI preparation is going to be, it's the fact, it's the truth, and the myth is something. Good day. Now we are going to the next topic. Having completed 27 topics on no IVF ICSI end to end, or say no IVF ICSI. It ended with very nicely. I got a very good reception, a very good response from the couples and the viewers. Now we are going to go to the next topic. So this topic is similarly, every topic I am coming with a title in such a way the title itself should give some positivity to the clients, because I feel before any treatment or before anything, positive comes with the value, that is nothing but a success. That's why I always become very optimistic, very positive. Though I am handling a field in medicine which is one of the treatments or a specialty beyond human touch, beyond human thoughts. Because if you do a surgery, you know what are all the challenges. There may be some bleeding, or there may be some hidden place where robotic surgery is needed or something. But only in IVF or ICSI, or only in infertility field, I feel the doctors are fully dependent on nature. In my view, it is called divine, because everybody are fully dependent, because they go and place an excellent embryos. Still, they will expect success, it will end up in failure. They will go and place an average embryo and they will expect average success, but they will end up in success. This is the difference. So now, this is the topic. Now, second topic is very interesting topic, and I am going step by step. Having taken the confidence of the couples that no IVF ICSI end to end, or say no IVF ICSI. This is covered in 27 topics in English and 27 topics in Tamil. Now we are going to the second level. What is that second level is no IUI, no IVF ICSI. No IUI end to end ends with success. It's a very interesting topic. Listen to the meaning. If you don't know IUI, no IUI, no IVF or ICSI. If you know IUI, end to end, it ends with success. So the word comes with so much of underlying meaning in it. If you know IUI, what is IUI? It means it ends with success. The success is nothing but a live birth rate. We need to understand. So now, the success can be a natural pregnancy, can be an IUI, can be an IVF pregnancy. But if you understand no IUI, because right from the beginning you should understand everything goes with an clarity, awareness and positivity. GSS is IC. You have seen many times. What is this IC? Infertility ends in conception. What is IC? IC, positivity, pregnancy and parenthood. 3 P's. See the way how I am inducing positivity in you. This is very important. I want my couples, before reaching me, before approaching me, before taking a counseling or consultation with me, should step in with me with that full positivity and confidence that when I step into GSS, I mean it is I see. That's all I see. You are seeing. It's all. That means what you're seeing. Infertility ends in conception. You have attained pregnancy. You are positive and you have attained parenthood. With this positive thought, if you step into anything, there is nothing as failure. After all, you have been born in this world to perpetuate, to reproduce. So, if you are going through some challenges, during your fertility treatment. Take challenges and take it positive, because every challenges will have an ending, and that ending is nothing but a success. That's all. So now let's move to IUI. Every topic I start with a positive thought. Right. Now what is my first topic? This is going to be 12 topics. IVF ICSI, it's 27 topics because it is expensive. IUI is average. It comes with 12 topics. So it is less expensive. I'm going to finish in 12 topics. And first topic, what you are thinking, the first topic. As usual, I want to induce positive in you. What is that positive? Success. So what is the first topic? It's success. What is IUI success? So maybe in Tamil speech, in the very first minute, I want to knock off all the viewers and I want to touch them. Go this video till the end. But here, I have gone through few minutes. At least now also I can take a call and try. If you want to give a shocking information or an alarming information or an unbelievable update which will make you feel acceptable at the end of this talk, is the topic now. Do you know one thing? The success of IUI is the same as the success of IVF and ICSI. Have I shocked you? Have I thrilled you? Have I given a surprise to you? Yes. Can you believe it? I am not giving any faulty information. Please take a note of it. Just for the sake of listening this video till the end. Never. I am very clear. My couples should never be misled. I am very positive. I am very clear in my thoughts. IUI success is equivalent to IVF ICSI and IVF ICSI success. How, doctor? How is it possible? Then why should we try for IVF or ICSI? Why can't we try IUI? That is what I am trying. Listen to this video till the end and understand and take a decision if you want to go for IUI or IVF ICSI. Yes, very limited couples, very few couples may have absolute contraindication to undergo IUI procedure, which will be given as a separate part, which will be coming in the subsequent parts. But majority, mostly, everyone can give a chance for IUI. Let me step into it. Have you listened to the 12th part of No IVF ICSI end to end, or say No IVF ICSI? Now you go and watch that video. 12th part of that particular IVF ICSI video. You will understand. I have given a 15 minutes elaborate speech about the success and its difference in IVF and ICSI. You make it very short and simple and make it very, because we are confined to IUI now. Let us take in IVF ICSI. What I told you. After the placement of embryo, you are going to see the first result on 15th day. They are going to do a biochemical, they are going to do a beta HCG test. They are going to draw a blood sample and they are going to test for pregnancy. What is it called? Beta HCG. It's called serum pregnancy test. Okay. So that test becomes positive and that percentage is nothing but 70 to 90. Okay. And if you go to the next level, the same female partner who has got the success, when they are going to go to the next level to see the heartbeat of the baby, maybe between the 10th to 12th week of pregnancy, unusually it comes down to 50 to 70%. So 70 to 90% has come down to 50 to 70%. Now let's go to the third level. So the same female partners who have got success in biochemical, who has got the clinical pregnancy, now going to the ongoing pregnancy, which is the mid-trimester, second trimester between 12 to 27 weeks. Most of the women are being filtered by abnormal babies, by miscarriages, by IUDs. So only 40 to 60% of the successful women are going through the second trimester. So come to the last stage. What is it called? Live birth rate. The live birth rate is nothing but 30 to 50%. I am telling little higher percentage. Ideally it will be around 20 to 40%. So my dear couples, now you tell me whether I have given any faulty update to you, have I misled you. So the success of IVF and ICSI is live birth rate is only anywhere between 30 to 40%, which is the same as in IUI. Now you tell, am I misleaded you? Whatever the updates I am given, you please go and verify, but the international guidelines says. I am not saying just for the sake of convincing my giving the couples or just for the sake of giving positivity to my couples. It's the fact, it's the truth, and the myth is something. Success in IVF and ICSI is high. Now you understand. So let us understand, because it's very simple. I've told in my Tamil speech, like without entering into school education, you want to enter into the college. It's same like that. Without stepping into IUI, you want to step into IVF or ICSI directly because of so many reasons. It can be a social pressure, it can be some urgency, or it can be some compulsion. So many factors are compelling you to go for IVF ICSI. How many couples watching this video touch your heart and say, I have tried IUI multiple times, or I have not given chance for IUI? Majority will be like this, because that myth that you have been primed in your brain, you have been primed in that way that IUI has a limited success. Let me take directly to IVF in ICSI and give increased success rate. Now I will break all those thoughts to you in the upcoming few minutes. Now let us see, in IUI, what is that 15 to 25% success rates? Let's see. In IUI, we are growing the eggs by two means, by giving tablets and by giving hormone injections. If you give only tablets, the success will be 15%. Now you understand that 15% in IUI is almost an assisted natural pregnancy, because we are injecting your spouse sperm, husband's sperm, into the uterus. That sperm is swimming all the way to the uterus, going to the end of the fallopian tube, fusing with the egg on its own, getting fertilized, and that fertilization is converted into the embryo. That embryo is coming back into the uterus after the 5th day and getting implanted. So it is all happening naturally. That is why the 15% is remaining there. So what you are getting is going till the end, because you are already fit to undergo IUI. Now you understand? So to boost that success, we are giving small amount of hormone injection to have that small negative effects because of the tablet. Okay, so that 15 will go to 20%. If you use purely hormone injection, it will go to 25%. And if you want to know the price difference, I am not disclosing it now, because cost of IUI is a separate topic coming in the upcoming 11 topics. It's a total of 12 topics and we are into the first topic. Okay, so 15 to 25%. So this is like a live birth rate. So after all, IUI and IVF is the same. Now my dear couples, I'll come to the second point about the success of IUI. Being for the first attempt of IUI, you are getting 15 to 25. You have heard of this successful IUI, successive IUI, cumulative IUI success. What it means, if the same couple who have ended in failure in the first cycle, the very subsequent cycle is called the second cycle, second attempt. If she fails in the second attempt, if they go to the very next month on the third cycle, it's called 3 successive attempts. So in the second time, the success is increased by another 5 to 10%. In the third time, it is further enhanced by another 5 to 10%. So somewhere 15 to 25 is going from 30 to 35% in the second or third attempt. Now you understand, it is becoming equivalent to IVF and ICSI, and you are spending thousands in IUI and lakhs in IVF ICSI. Now I will tell you clearly, forget the price of the IVF and ICSI. Lakh is nothing but anybody can earn, but you are losing some part of your health. You are going through artificial treatments. You are getting a lot of hormone injections. You are going to take a lot of medications. You are subjected to so much of deviation in your natural methodology. So it goes with a compromise. Your health is subjected to some sort of compromise. Do you need that? At the cost of your health, spending money is secondary, but to get that pregnancy, the same percentage comes in cumulative IUI means, why not you try IUI? What is the health risk you are going to take in IUI? Nothing. So Now let's understand this IUI and IVF has no difference in the success rate when you see the cumulative and when you compare to the live birth rate, LBR. Don't forget this word. I want to make sure every couple should have complete clarity and awareness, because that complete clarity and awareness only is going to give them the positive, and that positive thinking only will give them the success, and that success is only will give you the real success. The thoughtful success will end up in real success. Okay, so now we have understood this. Let me go one thing more optimistic. Anything, doctor, I am trying because you are my well-wisher. You have given me so much of efforts. You have told me to undergo IUI. I am going to try 2 to 3 cycles of IUI. I am failed. I have lost a few thousands. That is a waste. Now I am going to try for IVF. Did you get this thought in your mind? Have I read your mind? Yes. Now I am giving you the reply for that also. Your money is not wasted. Why? If you want to increase that success of IVF ICSI live birth rate from 30 to 50% to 100%, this cumulative IUI will be helpful. How? Because in this 3 months of cumulative IUI cycles, you are going to prepare yourself properly. That is the core ending. You are going to take some nutritional supplements. You are going to take some adjuvants. You are going to do some lifestyle measures. You are going to increase the positivity. Your awareness is increased. Naturally, with all these precautions, with all these preparations, where it is going to become a waste. Have you heard of this? A client, a couple who has failed in IUI have conceived naturally after the IUI. A couple, women who has failed in IVF have successfully conceived naturally in the subsequent months. These are all miracles happened, and it is not something very strange or unhappened events I am discussing. So never and ever think nothing is a waste. Your IUI preparation is going to be valued. So don't do anything with doubtfully or unhearted. With wholehearted, make every step with full positive note, because let's have this very clear thought in our mind. I want to align with the nature. Come what may. I have been with the nature. Nature has to give me this pregnancy. Nature is divine. If you are destined, if you are determined, if you are desperate, definitely majority of your people will get the answers from the nature. That is more important, and that you need to take it seriously. So just merely by money, merely by pressure, you cannot achieve that. So now you understood IUI is the hallmark, is really a gold standard, is only a time-tested treatment, and it has more refined ways. We will be seeing, I will give you so much of awareness how to gain the success in IUI, because many of you must not have realized so much of things have been ignored, have been removed, or have been not taken seriously when a client is undergoing through IUI treatments. It will be really alarming for you. It's from both the sides, from the couples and from the medical perspective. I will open up everything. I will make you understand when you go through IUI, how can you improve your success? How can you, by merely listening all to these 12 topics, get your knowledge, get your awareness, interact with your clinicians, make them feel what you tell, and let them also follow it, and you'll get the results. So now I have made it very clear, nothing is a waste. The success in IUI is a first step of your success. Let it be even a failing step. There is no success without failure. Keep it strongly in your mind. Every failing steps is ending in success. And if that success may be in IUI or IVF or ICSI or natural pregnancy. But take this failure as a first stepping stone and a learning stone, and that stone is needed. Without going to school, don't go to college. Same way, without trying IUI, don't step into IVF or ICSI. So the end of my topic is no IUI, no IVF ICSI. No IUI end to end and ends with success in IUI. So the first part is completed. I hope I have justified my topic. I have justified my speech by giving the success and its equivalency to IVF and ICSI. We are going to see in the subsequent topics. GSSSS is IC, positivity, pregnancy and parenthood. Infertility ends in conception when you step into GSS. Good day. Let's see in topic number 2.